Good morning. Today is Saturday, November 11, 2023. It's a regular yoga therapy class. Let's do some sound check here first. Be sure everything is in order. Sound check, 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 check. Okay. Check. 1, 2, 3. Okay, everything is in order. So, this is our regular Saturday morning yoga therapy class. As you all know, it used to be all in person until the pandemic. And during pandemic, it became your virtual. And since then, we're doing a virtual Saturday morning classes. On the last session, we talked about yoga therapy for the chronic pulmonary diseases. And primarily, we talked about the asanas, which were a chest opening poses, a lateral bend, your relaxation of the neck because the accessory muscles work, then overall relaxation response, and the hand strength. And more the hand strength, better is your respiration. And then second, we talked about that breath is the connector between your body and mind, because breathing is both conscious and subconscious. The subconscious breathing is in the brainstem, and conscious breathing is in our cortex, and is connected between our we call it a conscious and subconscious mind. So a tremendous amount of your mind is involved, and when you see something beautiful, what do you say? It's a breathtaking. When you get scared, we get a faster respiratory rate. And even we have seen a child with the asthma, like they have they get afraid, scared, maybe their parents are doing an argument, the children goes into a asthmatic attack. So the disease we're talking about, chronic pulmonary diseases, are primarily your asthma, your emphysema, COPD, the chronic obstructive pulmonary disease, and the pulmonary fibrosis. We went over with the whole pathology and physiology before, and we went through the whole practice. But primarily what we emphasize is that it sounds like that for all the pulmonary condition, lung condition, the therapy will be started with a pranayama. That's what a yoga therapy is. Yoga therapy is the adaptation of the yoga practices based on our clinical finding. But the people with pulmonary problem, they're so afraid of taking a breath, the fear, they're not able to do your pranayama practice to start. The first you have to do quieting down the mind. So we'll go through the practices today to see how this is all done. The same sequence, what we have done all the time, you do it. Sit down with your spine straight. Here I'm sitting in your kneeling stool, and called Merudanda Achal, then called Manasthir. Manasthir is called quieting down your mind. Mind in yoga is the content of your five senses, so able to control your five senses, which is the fifth limb of yoga, called your pratyahara. Pratya means reject, ahara means your input. Input is not what we eat, input is your five senses. I hear, we see, or smell, and taste and touch. And I've shown you how to do it. Do your mudras, put it in your over, close your eyes, do your breathing out longer than breathing in. The first, before any of the pranayama practice, this is a pranayama, but it's a quieting down your mind. So brain has a frequency, we create another frequency, we shut down our five senses. It is called Brahmari Pranayam. A bumblebee breathing, Brahmari Pranayam, which will be followed by your chanting pranayam. Chanting is your called Om. Om has the same frequency as the frequency of the brain. So what happened, the two frequency interacts, it causes a phenomena in physics called harmonic resonance, and your mind quiets down. Om has a three frequency, which is called your A, U, Ma. A comes from the lower part of the lung, U comes from the middle part of the lung, Ma comes from the upper part of the lung. It also associated with the three mudras, like when you touch your index finger and thumb, you put your hands high up. This is called a Gyano Mudra or a Dhyano Mudra. But if you put it down, it's called a Chin Mudra. Chin Mudra opens the lower part of the lung. Then if you close your other fingers, this is called a Chinmayi Mudra. Chinmayi Mudra opens the middle part of the lung. Then you put your thumb inside and close. This is called a Balo Mushti Mudra, like a baby fist, or a Adhi Mudra. It opens the upper part of the lung. This is called a Pranubho Pranayam. That is followed by called pumming and cupping. So let's do the practice now. So you will be able to see that how to begin. Like last time we talked about all the patho-physiology, all the asanas, and what the pranayamas to do. Today will be all the practice of pranayama. We'll do 3 Brahmari Pranayam, bumblebee, followed by a Pranabha Pranayam, and then pumming and cupping, and not going to be all in silence. And then we breathe out first, take a deep breath in and breathe out with the sound of a bumblebee. Put your index finger in the forehead. You do a Shanmukhi Mudra to close, or use your 3 fingers to close your eyes. Then use your thumb to close your ear and close your mouth. Breathe out first. Take a deep breath in and breathe out with the sound of a bumblebee. So when you do that humming and cupping, this heat over your eyes relaxes your eyes. Eye is connected to your brain. Eye has a maximum number of cranial nerves supplying it. Optic nerve supplies the retina, SO4, LR6, superior oblique muscle supplied by 4th cranial nerve, lateral rectus muscle is supplied by 6th cranial nerve, then comes the trigeminal nerve and also patho-physiology nerve. When the ciliary muscles get relaxed, the lens gets more convex, it acts like you're reading glasses. It's a powerful relaxation. When you massage the forehead, massage your face, the muscles are attached to your skin. When the muscles are all relaxed, your frowning goes away, your lying goes away, all the things you see in your face. Take your hand, massage the earlobe behind your ear, inside your external auditory canal. There's a branch of the vagus nerve called auricular branch of vagus nerve. It's called vagal stimulation. Bring the hand here, massage the carotid sinuses. Carotid sinus is supplied by your glossopharyngeal nerve, the hearing branch. It quiets down your nervous system and your cardiovascular system. Take the hand, massage the tubercle, occipital tubercle. Two muscles are attached here. Sternomastoid muscle and the trapezius muscle, all are supplied by cranial accessory nerve. to prove your point, just take a look at me. My whole mouth is full of saliva now. My mouth is wet. I've been talking to you, and the wet mouth tells you there's the activation of parasympathetic tone. I have not drank any water. I don't know when the last time I had some even water. Dry mouth is a sign of your sympathetic overdrive, because when you get scared, when you have a sympathetic overdrive, what do you get? You get a dry mouth. So wet mouth. So this is the beginning. Now you are ready, say, for asthma. Asthma, what happens? People can breathe in, you cannot breathe out. And I've talked all about your patho-physiology. What is that? Then if you just look at me when you relax, what happens? I will do a long breathe out. I'll take a breathe in and breathe out without any effort. Since you're relaxed, we've been doing for a long time, and you'll see how long I can do it just to show it to you. And you have to practice, because the neuroplasticity, the habit forming, will bring your breathing back, and that's how you will breathe even at night. Would you even sleep? So I'll breathe out first, slowly take a long breath in, then breathe out longer than breathing in. This was 10 seconds in, 20 seconds out. I'm still completely effortless. Effortless breathing means I can able to talk, I can able to sing. The relaxation technique is also you learn how to breathe out first. Empty your lung as much as possible, then we do. Also, we do with a health tracker. Here is my Apple Watch. We'll be doing all of our, and this is just basically a health tracker for us, and we'll do it. I'm going to show you some Bhastrika Pranayama. That's what I'm saying. So Bhastrika Pranayama is the beginning of a pranayama practice, and in a Bhastrika Pranayama, you can do sitting down in a chair, or you can sit down in your floor, on your mat. And since we're doing in a chair, this is my beautiful kneeling stool. Bhastrika is an active exhalation, active inhalation. Bhastrika is called a bellows. I'm sure I've shown to you, all of you, my bellows. One of my friends gave me a bellows because we are all the city people. I've never seen a bellows, and I have it here somewhere. Okay. So it's like this. The blacksmith uses, or you can use it for your fireplace. Inhale. This is the real bellows, okay? So now still a sequence. Inhalation, exhalation, inhalation, exhalation, okay? It's a rapid inhalation and exhalation, and yoga therapy practice is the balance. So here you can start with any asana practice, but say chest opening poses. Breathe out first, you breathe in and breathe out. We also do every morning your jalneti. We wash our nostril with our neti pot, and during a pranayama practice, you always can get some drainage coming out from your sinuses is normal. So it was inhalation, exhalation. Now what we'll do opposing, like inhalation, exhalation. That is a balance. Remember, health is a balance of your body, mind and spirit. Every practice you do a balance, huh? When you have a little coughing during pranayama practice, it is normal, because the cough comes from your larynx, and that's where all the pranayama practice is coming from. Now, speed, how fast you do, how slow you do, people all come to me, oh, you're asking, it's a very slow pranayama practice, don't do it. No, it is not the speed. It is able to do it effortlessly and without raising your sympathetic tone. So, we can do very fast. I can do very fast because I do it every single day. I've been practicing for a long time, and this is a part of my normal breathing. Same way all the long-term yoga practitioners, they've been doing it probably when they were born, they're born, they're doing the yoga practices. So if you have a slow, you can do a slow hand raise. Raise your hand, and you can breathe out first, take a deep breath in, and breathe out slowly with your Adhi Mudra. Then you can increase your speed slowly. And normally practice, remember, this is our gateway of a pranayama. It is your removing all the excess, your carbon dioxide, end product of your metabolism, and this is the beginning. And you should do as much as possible. Our schedule is we do 20 slow, and slow in the sequence we call it Ishwar, 20 medium, in the sequence called it so hum, and 20 fast is called it's called Vishnu. And that your one sequence, or call it one set, we keep on doing it, 2, 3, 4 sets, but we do it as long as we don't have any efforted breathing. People ask me how long I should do, how long I do Kapalbhati Pranayama. I said, you do it as if it's your normal breathing, and when effort, yes, when you can do, people like us doing it for a long time, yeah, we do about 10 to 15 minutes of Kapalbhati Pranayama, we do 5 to 10 minutes of alternate nostril breathing, we do about 3 to 5 minutes of this Bhastrika Pranayama. In a 1 hour practice, we do 25 minutes of asanas, 25 minutes of pranayama, 10 minutes of meditation. That is our daily practices, and these are part of our daily practices. What we're doing pick and choose for our people with chronic pulmonary disease. So let's do a one sequence or one cycle to show it to you, and then you can repeat them. So 20 slow, ish short. I always do it with my eyes closed, so my whole attention in towards my practice and my breathing. This was 20 slow in a sequence of ish. Now we do 20 your medium speed called so hum. Then the third speed, then the 20, is called Vishnu, Vishnu, Vishnu. So this is 3 cycles. For 20 each, about 60, and you keep multiplying. Generally try to do about 3 or 4. At 200 is very good, and you do it about between 3 to 5 minutes. It's a wonderful practice to start with. And if you don't want to raise your arm, there's another way. And as I said, we'll do very rapid because it is our practice that effortless. So everything I'm doing, I'm talking, I'm even singing. So my breath is effortless. It doesn't matter how slow you're doing. If you can, at the beginning, you can do only 3 seconds, 5 seconds, do it. Because if you keep on doing it, neuroplasticity will set in. You will be able to do increasing slowly and slowly. Because your lung has a 6-liter capacity. You only need 1.5 liter to keep it open. You have 4.5 liter air you can exchange. I can exchange a tremendous amount of air in and out now. Normally you breathe in and out for tidal volume only 500 cc, half a liter. So out of 4.5 liter, you are exchanging only half a liter. So you have 80 to 90% reserve in your lung. So if you can do it a little faster, sitting down with the shoulder raised, and let me do it for a short time, for a few hundreds, and you will see how easily it is done. I just did 300 of them. And generally you could do a lot more, about 5, 6, 7, 8, or sometimes 1,000 of them, but they're effortless. It creates a tremendous amount of your hyperventilation syndrome. Get a carpopedal spasm, altered sense of consciousness, feel it. You also get some saliva in your mouth, and you might get some spasm, called carpopedal spasm. The hands and the feet may get a spasm. It's entirely normal. A lot of people come and ask me, I feel something very different when I'm doing a Bhastrika Pranayama. Good. If you can do this amount of Bhastrika Pranayama, I can guarantee you any chronic pulmonary disease will run away from you. And we have a tremendous amount of your patients who have been practicing it for years and years, and they're off medication. They're having a comfortable. Remember, lung. When I die, what happened? Expired. Lung stops, then the heart stops, then the brain stops, the cellular function stops. As easy as it is. Improve your lung function, improve your heart function. Improve your heart function, improve your brain function, improve your cellular function. All the cellular functions are based on your able to breathe and able to improve your breathing capacity. This is also called a prano-pradhan pranayama. Prana means prana is the life force which keeps us awake, alert and healing. We are bringing all the prana with this Bhastrika Pranayama. Next one is the Kapalbhati Pranayama. You have a balloon here, you have a diaphragm, you have another balloon here. You put your attention, your belly button, push your belly button inside, and it pushes your diaphragm, pushes your lung and heart, and all the air comes up. It is an active exhalation and passive inhalation without knowing. Bhastrika was an active exhalation and active inhalation. See, going against the grain of your habit is yoga. If you used to put the right foot all the time, start putting the left foot now. You'll see you are going to activate your both sides of the brain. You're not lateralized. We do it 10 mudras. These mudras, as I said, hand represent the 5 elements. The space is the middle finger, air is the index finger, fire is your thumb, water is your little finger, and earth is ring finger. So based on that, the Vata, Pitta and Kapha get balanced. Touch your index finger and thumb, you put it over in the, this is called your Dhyana Mudra, Jnana Mudra, or your basically quieting down your Pitta. If you put an index finger down and that, this is called your Vayu Mudra. Vayu Mudra, it controls your Vata. Very good for controlling the pain, neuropsychiatric disorders. Touch your middle finger and thumb, this is your Shunya Mudra. You're touching your, balancing your space, the fire, it causes your, improve your hearing. Touch your ring finger and thumb, the Prithvi Mudra. It's a grounding. It balances your kapha. Very good for obesity, diabetes. Touch your little finger and thumb is the Varun Mudra. Controls your water content of your body. Controls your bladder function. Whenever incontinence bladder, you do it a Varun Mudra. It improves your skin because there is a vasodilatation and more perfusion, blood coming through your skin. You start, it looks like you're even glowing. Touch your middle finger, ring finger and little finger, the thumb, Shakti Mudra, strength. Wake up in the morning, you don't feel good, that's right. Do a Shakti Mudra. Middle finger, ring finger and thumb is your Apna Mudra, Pachan Mudra. It is good for your digestion. And it is, Apna means the downward force, the Apna Vayu. All the excess in your body goes away. And if you put index finger down, it's called a Apna Vayu Mudra. In Apna Vayu Mudra, it's called a Hriday Mudra. It improves your cardiopulmonary function. Very, very important. Then you get a Linga Mudra. Linga Mudra, it is like your expectoration. All the cough comes out of the Linga Mudra. Then you have a lot of other mudras we had you can put all the fingers, you get a Vyana Mudra, but we do about 50 in each, but we do it completely silence and do the mudras and practice. We do it maybe about 20 each, and it massages all the internal organs, and I tell you the function, and it is very effective for, stimulating your vagal function. Gently put a finger here and push your belly and air will come out. So 20, I've done an active exhalation, I'm pushing out, I've been inhaling without knowing. Vayu Mudra, it massages all the internal organs. Massages your liver, massages your stomach, massages your spleen, massages your colon, massages your pancreas, massage your small intestine. For the women, massages your uterus, massages your ovaries, massages your tubes. For men, massages your prostate, massages your blood. It also massages your diaphragm. Shunya Mudra improves your hearing. It also massages your diaphragm, massages your lung. So all the residual air will come out from your lung. In between the lung, you have a heart. It also slowly massages your heart. When you massage an organ, the organ function gets better. So this is like your internal CPR, cardiopulmonary resuscitation. So do it very gently. We do it very gently, 1 per second. And when you do this pranayama very fast, it becomes a kriya. So let me show it to you how we do it. Do just a 20 instead of 50 with every mudras, and you'll understand. It really called the Agni Pradhan Pranayama. It ignites your Agni, so you get your tejas. So your face looks like you're glowing. Then you get a Kapal Bhati. Kapal is a forehead, Bhati is a shining. Looks like you're shining. So here I am with the Prithvi Mudra. Varun Mudra. Shakti Mudra. Apna Mudra. Apna Vayu Mudra. Linga Mudra. Within a short time, you have no connection with the outside world, you don't know even how much you are counting, you keep on doing it, and it's a wonderful practice, the Kapalbhati Pranayama. It is followed by your called three bandhas. The bandhas are your locks. It's called a root lock. You contract your all the pelvic organs and anal sphincter and you pull it up and hold. If you have abdominal lock, Uddiyana Bandh, you breathe out first, then breathe in, breathe out, suck your stomach in and hold. It follows with the Agnisar Kriya. You massage all the abdominal organs with the breath holding in exhalation. Then it comes with the chin lock, and chin lock comes with the touching your chin to the chest. It stimulates your carotid sinuses, and chin lock is associated with your breath holding in inhalation called Abhantarin Kumbhak. Abhantarin Kumbhak with the chin lock, which is called your Murcha Pranayama. Murcha means almost unconscious. We can also do this in sequence of breath holding. Breath holding is very important. It is called a Savitri Pranayam. Savitri Pranayam is 1:4:4:2. That means you breathe in for 4 seconds, hold for 8 seconds, breathe out for 8 seconds, and hold for 4 seconds. Very simple, you can do it. But let me show you first with the bandhas and with your breath holding. Very important. Breath holding, people say, don't do it. No, again, it's not don't doing it. Doing it effortlessly. If you can hold it for 2 seconds, go for 2 seconds. Keep on doing 2 seconds, and in 2 weeks or 3 weeks, you'll see you can do 4 seconds. 4 seconds will do 8 seconds. Breath holding in exhalation, 20 seconds, 25 seconds is great. Breath holding in inhalation, 40-45 seconds is great. And you could, practice, you can do 1 minute, sometimes 2 minutes. So breath holding in inhalation. First, you do the breath holding in exhalation, which is your Uddiyana Bandh, abdominal lock, and with your Mula Bandh, and we'll do it all 3 locks together, which is called your Mahabandh. Breathe out first. Deep breath. We'll do a deep breath in, we'll breathe out and suck your stomach in, hold. So I will explain to you anymore. As again said, that coughing The coughing is essentially is okay, it comes from your larynx. During this holding, I was doing also the mula bandh, contracting your pelvic floor, pulling your anal canal up. For the Agnisar Kriya, the same sequence, then you move your abdominal wall and see how long it lasts. Generally, we do I do about 3, Uddiyani bandh with 3 your Agnisar Kriya. Generally try to do between 7 to 10 for a daily practice. I generally do all with my Adhimudra because Adhimudra is relaxing. Again, look at my mouth is still wet. Talking. I've been talking to you for a long, long time. Again, the sequence will be I breathe out first, take a deep breath in, breathe out, suck your stomach in, and move your stomach front and back, abdominal wall to massage your abdominal contents. So I will explain in between. Agnisar Kriya, massaging your old abdominal organs with your abdominal wall in a breath holding and exhalation. Breath holding and exhalation, breath holding and inhalation in yoga is called a Mrita Sanjivani. Mrita means dead, Sanjivani means alive. It says it awakes or makes a dead person alive. Chin lock, called your Jalandhar bandh. Chin lock is basically pulling your chin down at the chest, and chin lock is associated with your breath holding and inhalation, called Abhyantarin Kumbha. Kumbhak is a breath holding. Purak is a inhalation. Kumbhak is a holding. Rechuk is exhalation, and Bajja Kumbhak is your we call it suspension. Breath holding and inhalation is called retention. So let's do the way we'll do it. Breathe out first, take a deep breath in, we'll hold our breath and do a chin lock. It is so effective that it puts you to almost makes you unconscious. It's a murcha pranayama. So about 45 seconds, breath holding and inhalation. This will incorporate a Ujjayi pranayam, which I'll do it next, and then with the left nostril breathing, which is cooling, called your Chandravedi pranayam. And the combination of these three, when it's done, it is the most meditative experience in controlling or therapy for the pulmonary disease. And we'll do it at the end of our practices. This followed with an alternate nostril breathing, which is called Anulom Vilom Pranayama, and we do it every single day. Every single day we'll do the Bastrika, Kapalbhati, and alternate nostril breathing, Anulom Vilom Pranayama. That will followed by with your Brahmari Pranayama, bumblebee, which you have done before, which is done with your Pranayama Pranayam, which is the beginning, followed by your Ujjayi Pranayam, which is called a resistive inhalation, Shankha Pranayam, resistive exhalation, and will end up with the combination for your meditative pranayam. Alternate nostril breathing. Left nostril is controlled by the right brain is intuitive, right brain is female, right brain is, cooling, right brain is your parasympathetic. Right nostril is controlled by the left brain is analytical, left brain is male, left brain is heating, left brain is your sympathetic. So when you do the alternate nostril breathing, it activates both sides of the brain. Dhanu Mudra, over your left hand, you close your right nostril. You don't have to do it completely closed, you can just go underneath. Oh, before that also you like to check the patency or how both the nostrils are open. Generally, you'll see your one nostril is more open than the other side. And the cycle goes on between 90 minutes to 120 minutes. And then naturally you do alternate nostril breathing. We do a neti path and a jal neti every single day. So let me show it to you. Here I am, I'm closing my right nostril, I'm breathing in and out from my left nostril. My left nostril is open. Let's check the right nostril. Both of them are open, but I think my right nostril is little less open than the left nostril. We'll do alternate nostril breathing and we'll do the sequence and see how long you need to do. Dhanu Mudra or Gana Mudra. Close your right nostril, just a little. Breathe out through your left nostril. Breathe in through your left nostril. Close your left nostril with the ring finger and little finger and breathe out your right nostril. Breathe in through your right nostril. Breathe out through your left nostril. Keep doing it until you have any effort in breathing, and if you can do it for a long time, you do generally between 5 to 10 minutes. Left nostril is cooling, Chandranadi, parasympathetic. Right nostril is heating, Suranadi, sun energy, sympathetic. It also starts from your root of your spine, the two nadis called Ida and Pingala. Ida comes out your left nostril, Pingala comes right nostril. Many a time you'll have a little needed support, and I generally like to do it when I'm sitting down in the ground. Sometimes I support it, or I can many a time support with this and continue my alternate nostril breathing. That slowly incorporates putting your index finger and the middle finger in third eye, closing your eyes, and bring your awareness to your third eye. Also, do a super brain yoga, which is holding the opposite earlobe. With my left hand, I hold the right earlobe, and then I continue my alternate nostril breathing. So continue on this as long as you can do it effortlessly, and you can read all the data which it does, but most important is experiential. You will see you have a saliva in your mouth, parasympathetic activation. You will see you will have a your all the health parameters here. It's a wonderful experience. This also incorporates a breath holding called Nadi Shuddhi Pranayama, and it starts with your a Vishnu Mudra. You take your index finger and middle finger, put it on your palm, and make a little pinch with a little finger, ring finger, and thumb. The ratio is 1:4:2. You breathe in for a count of 4, hold the breath for a count of 16, and breathe out at the count of 8. When you can do it more and more, you can keep on increasing it, like a breathe in for a count of 5, hold it for a count of 20, breathe out for a count of 10. By the time you can do it, these things, a chronic pulmonary disease says, hell, I don't want to be in this body, in this mind, forget it. So let's show it. Vishnu Mudra. Breathe out through your left nostril. Breathe in through a count of 4 in. Hold your breath for a count of 16. Breathe out with a count of 8 out. This is one cycle of Nadi Shuddhi Pranayama. Nadi is a channel cleansing pranayama. Now you can do a little bit more with the neuroplasticity. So I'll show it to you. 5 inhalation, 20 holding, and 10 exhalation. I'll start with now from the right nostril. Breathe out first. Breathe in count of 5 in. Breath hold for 20. Breathe out with a count of 10. Wonderful practice. Also remember the abdominal breathing. Abdominal breathing is very relaxing, very quiet. And you see the babies. Babies all do abdominal breathing. And abdominal breathing is a parasympathetic activation. This is activating both sides of the brain and with a breath holding, cleansing your channel. Nadi Shuddhi Pranayama. This follows with your mind, quieting down your mind. This is your Brahmari pranayam, bumblebee breathing, which you have done at the beginning, and your pranayama pranayam, the meditative pranayama. Well, I'll show you at the end the meditative pranayama, which are the end of our practice. And then this will be followed by your cooling pranayama. A cooling pranayamas are your Sitali pranayam, Sitkari pranayam, and also you do, remember, you always breathe through your nostril, breathe in and breathe out. You don't use your mouth. Because if you breathe in through your mouth, you don't know where the air has gone. It could have gone to the stomach, but if you breathe in through your nostril, it all goes into your lung. It's through your nose, so that terminates, behind over your mucus. And we have done it, in meditation practice. We have shown it to you. So, we use our mouth only for your pranayama practice. Adhimudra. It's a breathing in through your nostril, breathe out through your mouth with a tongue rolling in. Breathing in, like roll your tongue, breathe in. Close your mouth, breathe out through your nostril. With few breathing, you'll see your whole inside will get cooled down. Very good for gastroesophageal reflux, very good for women with hot flushes, very good for a cooling effect in your body. And sometimes the problem with the tongue sticking out, you can put the tongue in the top and breathe it through your teeth, which is called a Sitkari pranayam. And also when you touch just the teeth and the tongue, called a Shodanto pranayam. Show you, Sitkari pranayam. What a cooling effect you get with this. Ujjayi pranayam, which is a victorious pranayam, you slowly constrict your larynx and first you breathe in and out. It's called a resistive inhalation. Finally, you just try to completely close it and try to breathe in, and you will see this is not an effort, it's all relaxation. Because in an effort, you'll see your accessory muscles of the breathing will be working, which in pranayama practice is not. When you see the accessory muscle of breathing, that means you are pushing yourself too much, and that pranayama is not going to have any effect in your body and mind. In larynx is supplied with the superior and inferior laryngeal nerve, which are branches of the vagus nerve. The input goes into through the vagus nerve, which is 80% is your input to the brainstem, and output comes out through a hypoglossal nerve, which supplies your tongue, and glossopharyngeal nerve, which supplies your soft palate. So that it pushes the tongue in front and it tightens up the soft palate. What it does, when it pushes the tongue, called the glossopharyngeal nerve, it is a very wonderful therapy for your sleep apnea. And when it tightens up your soft palate, there's a muscles called palatopharyngeus and palatoglossus, and it almost acts like a tightening of the soft palate, and it takes care of your snoring. It's almost like called a UVPP, uvulopalato-paryngoplasty, the surgery done by the ENT people. So you will see me, first, I'll be doing a very gentle breathing in and breathing out with the larynx closed, with the inhalation resisted. It is called your ocean breathe or your is called your dirt weather breathing. But for therapeutic purposes, you go back with a little bit. So I have tremendous saliva in my mouth. So you will first do it very gently, very slowly, like this. Then increase it slowly and hold it. Again, having a cough, that means you have hit the target. Chosen down. Ujjayi pranayama. Ujjayi, victorious. This Ujjayi pranayama, when you do it with your chin lock and left nostril breathing, you can think about activating vagus nerve, activating your, with the chin lock, you're activating your glossopharyngeal nerve, and then the left nostril, you're activating the right side of the brain. What a combination of calming, cooling pranayama practice. We'll show you one time how it is done. Ujjayi pranayama first, followed by your chin lock and the left nostril breathing. Can't have a better practice than this. Talking about pulmonary disease again is not going to run away from it. So we did a resistive inhalation, you're also going to resistive exhalation. When you do anything, practice against resistance, it improves your function. So the blowing a conch shell, called Shankha pranayama. So I have a conch shell somewhere, but what do? We use our hand as an adhimudra. Put one on the top, and this way now will be opposite. You'll be breathing in through your nose and breathing out through your mouth against resistance, as if like blowing a conch shell. Breathe out first. Breathe in through your nose. You have Plavani pranayam, a lot of other pranayamas, as I said, Savitri pranayam, which is breath holding. We're getting there the time, let's finish it. But it will look like a meditative pranayam, which will look like initially almost impossible to do it, which is called your alternate nostril breathing without closing your nostril. It's a total meditative practice, and you know very well we have three bodies: gross body called Sthula Sharir, then subtle body called Sukha Sharir, then you have a causal body called a Karana Sharir. The subtle body, Sukha Sharir, is the body of your mind. That means you are looking at your body for years and years and years. You know exactly what your bodies are, and you can find the whole body with the closing your eyes. My eyes are closed. I can touch my forehead, I can touch my left ear, I can touch my left shoulder, I can touch your left index finger, the left hand, I touch my right thumb. There is no end of touching with closing my eyes. So same way, when you bring your awareness to your nostril, you'll be able to do it a single nostril. Okay? A lot of saliva in my mouth. So initially what you do a little meditative practice, and meditative practice is the focused meditation, focusing on your breath. Following the breath medication, you will do a alternate nostril breathing without closing your nostrils. And you'll see, we'll do it in sequence, we'll do it in silence. First, bring your awareness to your nostril. Breathe out first. Bring your awareness to your breath. The breath is entering through your nostril. Your air from the outside is getting filtered by your nostril. Your nostril is also in a personal air conditioner. If outside air is cool, it is warming it up. If outside is warm, it is cooling it down. Air is going to the side of your nostril, which are called a turbinate. These are like a channel. The air gets into a speed, like almost like a vortex. This vortex then runs over the mucosa of your sinuses. Mucosa of the sinuses releases a substance called a nitric oxide. Nitric oxide is a potent vasodilator. It opens up the blood vessels. It improves your endothelial health, and endothelium, lining inside your blood vessels, primarily your coronary arteries and all the blood vessels. Endothelial health is our health today. It also is a very good activator of your parasympathetic tone, like acetylcholine, cyclic GMP. Air is going behind your throat. You are visualizing. Air is coming through your trachea. It's going to the upper part of the lung, middle part of the lung, lower part of the lung, almost your level of the belly button, where the breath stops. It's called a cable kumbhak. Visualize the air is coming out, lower part of the lung, middle part of the lung, upper part of the lung, behind your throat, coming out through your nostril and outside. Outside the nostril, it picks up prana. Prana is a subtle energy which keeps us awake, alert and alive. Prana is not your breath. Metaphorically, prana is like electricity and breath is like your electric cable. In our yogic tradition, our whole body does breathing. Our skin is breathing, our liver is breathing, kidneys are breathing, and prana goes to the organ of healing. It's called pranic healing. Visualize the prana is coming in with your breath, and visualize the prana going to the organ of healing. For me, I have the heart condition. I'm visualizing the prana is coming to my heart and with the healing of my heart. I also have my back problem, back pain. I'm visualizing prana is coming to my back and healing my back. Pranic energizing technique. It also goes my knee joint, hip joint, and wherever I have my pathology. If a diabetes, visualizes going to a pancreas. After this focused meditation, now bring your awareness to your left nostril. Breathe out through your left nostril. Breathe in through your left nostril. Breathe out through your right nostril. Breathe in through your right nostril. Breathe out through your left nostril. I can clearly visualize, and if I have a microphone, I could even show it to you that the breathing is going through the one nostril. Now you do it in silence. Let's do it in a few minutes in the silence before we finish our session today. Slowly put your hands together, touch your little finger and thumb. Separate your ring finger, middle finger and index finger. Lotus Mudra, Padma Mudra. Bring the Padma Mudra, it connects your body and mind and spirit. Bring it towards your heart. Heart is the site of your soul. Pranayama does your physical wellness, mental wellness, spiritual wellness. Pranayama. Prana is a life force. Yama means able to control and restrain. It a voluntary regulated breathing. Please, don't compare with the breathing exercise. It is not a breathing exercise. It is a voluntary control of breathing, activating your parasympathetic tone and activating relaxation response. Put your hands together in front of your heart chakra. Bow your head down. Say Namaste. Namaste means I honor the divinity within you. You are divine, and that divinity helps me in healing. The support I get from you, my fear of unknown goes away, my stress goes away. I'm in a state of parasympathetic activation, relaxation response, a wonderful therapy for chronic pulmonary diseases. Thank you for joining. If you have any comments, questions, please put it in the Facebook. I'll be trying to answer them. And as I said, as long as I'm in town, I'm coming on Saturday. Last Saturday, I had another program at the same time, so there's a conflict, so to cancel it. So hopefully I'll be able to come next Saturday, and I'll put it in my Facebook so you will know the session is on for the Saturday. Thank you for joining.